The Canadian government has systematically attacked the Indigenous community's right to express their identities through self-governance and culture. We've seen evidence of this with legislature like the Indian Act, where hereditary chiefs weren't recognized. We've seen it with the enactment of residential schools, where Indigenous children were ripped from their homes, their names taken, and their languages forbidden. And we can see it even still today in regards to healthcare, in that Indigenous people are forced to access a westernized government-operated and funded healthcare system that not only doesn't represent their holistic and cultural values, but is a system operated by a government that has continuously destroyed their communities and committed heinous crimes against them as a people, creating a major conflict with regards to access and trust. The Indigenous community's response to this issue in particular, but also in all things, is an unwavering resiliency and strength, incorporating traditional methods of healing and medicine that is for their communities by their communities, and spread through outreach and privately funded programs.
We sat down with someone working to meet the healthcare needs of the Indigenous community in order to better understand the issues they face.
My name is Jane Harrison, and I'm honored to be a member of our Anishinaabe Health Mobile team. We go out to the encampments and to our Indigenous populations and other populations who are vulnerable and isolated to provide them with primary health care. We're doing COVID testing, COVID vaccinations, and surround them with the circle of care. A significant number of our population are Indigenous populations, living transient, vulnerable, and homeless. And our other populations are populations that are living under the same circumstances. Unfortunately, the populations that are homeless and transient within our population and other populations is growing extensively because of the circumstances currently with the people that were housed and were unable to pay their housing are now moving to transient and homelessness. So we've been moving really diligently to help these populations. There's so many access problems. I mean, there's access in terms of racism. There's access in terms of stereotypifying Indigenous people. There's access in terms of just making your way through the system because of our history of being tortured and abused under the medical system. There's a lot of fear and anticipation because you've had so many bad experiences. So there's so much historical trauma that I just it's such a hard question to ask. I think most, everybody that goes through the system, we have a navigator to go through with you. And so the question was like, why isn't there Indigenous space in institutions? There's space for chapels. There's always space for whatever, but there's no Indigenous space. Mm-hmm. So as a group, we decided they should take out the Tim Hortons and just make it into Indigenous space where Indigenous people can practice, when Indigenous people gather together, from outside the hospital, from employees in the hospital, from the institutions, and also from the clients and patients, but everybody can have that space.
What would you say as a call to action for someone who wants to help reduce the inequalities that exist?
I really don't know. I'd say collectively get together and just collectively, be of one mind and think emotionally, come from your heart, and listen to the people.
I am going to talk about the Indigenous population in Canada. Indigenous people make up only 4.3% of the overall Canadian population, but comprise 30.6% of the youth homelessness population. 56% of First Nation people and 55% of Métis reported being diagnosed with one or more chronic conditions. Life expectancy of Indigenous people is 82 years, and this statistic was taken in 2019. Indigenous population have a lower life expectancy in Canada due to the effects of colonization, racism, and intergenerational trauma on Indigenous people have contributed to their poorer health and shorter life expectancies.
Sorry, could I have you say that again?
So one of the elders said when you're talking about rebuilding things so that you could have more Indigenous or more kind of like be that home or be that community place. And she said, yeah, you can't rebuild something that already exists, but we can build our own.